what do you see the future of cardiothoracic surgery to be?
It's interesting that our specialty is recently seeing a decline in the number of applicants, and it's probably related to many factors. There's a little less money in the field, there's more time that people would like to devote to the training, and recently there's not many jobs. So we'll see what happens. The specialty itself is try to restructure the way it's training people and try to refocus on things to improve that situation. And I anticipate in the next 5 to 7 years it will improve. But it's a bit of a growing process, and therefore there are growing pains.
Last year, 15% of all the graduating heart surgery residents did not get one job offer. So not only are there fewer being trained, but there are fewer getting jobs, because let's say you go to a town where the surgeons are 50 years old, 60 years old, and they're doing just fine, they're practicing fine. Well, because they've been cut, their compensation's been cut over the last few years by 51%, what is their incentive for hiring a new young person? Mm-hmm. Well, you hire somebody to work, allow you to work less, but the reality is most of these guys are willing to just operate until they're ready to quit, and then they quit.
I think it's very, the future is very good. I mean, we've done analyses through the American Association for Thoracic Surgery, working with the American Association of Medical Colleges, which is based here in D.C. And there's no question, when you look at the demographics, you look at the U.S. population and the age of the baby boomers and the incidence of acquired heart disease, there's no question there's going to be a substantial increase in the amount of work for cardiothoracic surgeons over the next 20 years. At the same time, the number of cardiac surgeons is doing this. So there's going to be a big gap, and within 5 years there's going to be a lot of concern. There is already, for those of us who are doing the analyses. In 10 years, unless something really major happens very soon, since the training time, the lead time is about 10 years for a cardiothoracic surgeon, in 10 years it'll be a disaster. There will be such a shortage of cardiothoracic surgeons for the amount of work that will be there that I mean, the only solution that can occur is a big import of foreign physicians. It's the way that other countries have handled it. The UK is about 25 years ahead of this country with the problem, and what they've done is to increase the percent foreign doctors in the UK. I believe is somewhere in the 40 to 50% range, and that's exactly what will happen in this country. Is basically physicians will be predominantly foreign, because this country is just not, well, cardiothoracic surgeons will be predominantly foreign, because this country is just not training enough people for the amount of work that this one needs.
There's plenty of demand, plenty of job opportunities for this field.
No question.
Yeah.
And you know, while in the last 2 or 3 years, because of the impact of stenting by cardiologists, has taken away some work from cardiothoracic surgeons, it's like any new technology goes through a period of big excitement. We think this is going to be the cure-all, and the reality is, as we've seen in the last 6 months, that stents are not a cure-all in patients. Many patients do need coronary surgery, and so the amount of work that's out there for cardiothoracic surgeons is definitely going to increase. There's no question. Every analysis that's been done has shown.
More and more surgeons are venturing out, opening their own business ventures in the healthcare field, as well as running organizations, and also trying to organize. We are not very good organizers. As cardiac surgeons, we do not rally groups together. We are very individualistic, most of us. We do very well in our little domain. We are not very, we do not rally big troops very well. And this is what we need to do in the future to keep this surgical specialty thriving and make it more successful. in the long term, we know, like you have the iPod Nano, things are getting more refined, you're getting more and more user-friendly. We are going to see people wanting intervention techniques which are less and less invasive. 20 years from now, I do not see too many major procedures requiring big incisions. The future cardiac physician, as I may call it, would be an interventionist surgeon, because he would have the same results of surgery but by doing intervention. So you would be able to do more with spending less time in the OR, getting better optimal outcomes, as well as being able to be more effective in the community. There would also be a situation in which you would be able to be the primary, to a certain extent, a primary interactor with your patient, which is slowly we have lost over a period of time. Our conduit to our practice today is through the primary care physicians and the cardiologist. We hardly ever meet them, hardly ever meet our patients.